Hi, my name is Jordana Guillén Hidalgo. I'm studying medicine at Catholic University. My subject is medical English, and the topic I'm going to talk about is metronidazole associated encephalopathy. Definition: what is metronidazole? Metronidazole is an antibiotic and antiprotozoal medication. It is used either alone or with antibiotics to treat pelvic inflammatory disease endocarditis and bacterial vaginosis. It is effective for drocunculiasis, giardiasis, trichomoniasis, and amebiasis. It is the drug of choice for a first episode of mild to moderate Clostridium difficile colitis. It is available by mouth, as a cream, and intravenously. Encephalopathy. When referring to a finding, encephalopathy refers to permanent brain injury or a reversible one. It can be due to direct injury to the brain or illness removed from the brain. When referring to a disease, encephalopathy refers to a wide variety of brain disorders with very different etiologies, prognosis, and implications.
Metronidazole. A nitroimidazole used to treat amoebiasis, vaginitis, trichomonas infections, giardiasis, anaerobic bacteria, and treponemal infections. It has also been proposed as a radiation sensitizer for hypoxic cells. According to the fourth annual report on carcinogens, NTP 85002, 1985, P133, this substance may reasonably be anticipated to be a carcinogen. Merck, 11th ed.
Applications in medicine. A 58 years old man with cryptogenic cirrhosis was admitted to the intensive care unit with confusion after a fall at home. He had been taking metronidazole 500 milligrams 3 times per day for more than 3 weeks for Clostridium difficile infection. A few days before his hospitalization, dysarthria and gait instability had developed, which has contributed to the fall. A magnetic resonance imaging scan of the brain showed a symmetric and asymmetric attenuate inversion recovery signal in the dentate nucleus of the cerebellum, a finding that is consistent with encephalopathy associated with metronidazole use.
Encephalopathy, disease, damage, or malfunction of the brain. In general, encephalopathy is manifested by an altered mental state that is sometimes accompanied by physical changes. Although numerous causes of encephalopathy aren't known, the majority of cases arise from infection, liver damage, anoxia, or kidney failure. The term encephalopathy is very broad and, in most cases, is preceded by various terms that describe the reason, cause, or special conditions of the patient that leads to brain malfunction. For example, anoxic encephalopathy means brain damage due to lack of oxygen, and hepatic encephalopathy means brain malfunction due to liver disease. Depending upon the cause and severity of the condition, symptoms may range from mild alterations in mental status to severe and potentially fatal manifestations such as dementia, seizures, and coma.
Pros and cons. Pros. On admission, the patient was intubated for airway protection and was sedated. Discontinuation of metronidazole resulted in resolution of the imaging findings 1 month later. Cons. Central catheter-related bacteremia developed soon thereafter. Neurologic assessment was difficult, and the patient never regained his baseline mental status.
Clostridium difficile is one of the bacteria that can cause severe antibiotic-associated diarrhea. It can be debilitating. It's usually treated with antibiotics, and the antibiotics usually cure anywhere from 50 to 75%. But it's recurrent in the others. It keeps recurring, and it's very difficult to treat.
Without the protection of our normal bacterial flora, an overwhelming growth of C. diff can cause serious complications.
Between 15 and 30,000 people a year die of Clostridium difficile in the United States of America. More people are dying of C. diff in the United States now than are dying of HIV. The question is there data to say that probiotics can prevent this? Well, there's growing data. There's now 2 major papers. One of them is in the British Medical Journal, and a bunch of little papers that say we can at least decrease antibiotic-associated diarrhea. And the newer ones are showing we can actually decrease C. diff now by just giving pennies a day worth of probiotics. In our hospital, everybody gets an antibiotic as an option to take in some yogurt too.
Issues apply in Ecuador. Encephalopathy associated with metronidazole use is an uncommon side effect of the medication. It typically manifests as dysarthria and gait instability. Risk factors include liver dysfunction and a prolonged course of metronidazole. Typical cumulative dose more than 20 grams. MRI of the brain is usually diagnostic and typically reveals a symmetric and flare signal in the dental nucleus of the cerebellum.
Hi, I'm Dr. Greg Hall, and for whatever reason, your doctor or a nurse practitioner has put you on Flagyl or Metronidazole. It's a medication they use to treat a wide range of things, but it's a medication that I thought it was worth doing a little video on just to make it clear. Sometimes they'll give you a big dose of it, like 2,000 milligrams, where they might give you 4 or 8 pills to take all at once. Other times, they'll give you the pill to take 3 times a day for a period of like 7 days. Either way, you'll want to take the pill however it's prescribed, which makes sense. Many of my patients will say that Flagyl or Metronidazole is a very bitter pill. What a bitter pill. Well, you're going to want to take it with orange juice or some kind of a juice because it has a bitter taste and you're going to have to just get past it some kind of way. But just be forewarned that that's an issue. The other issue with Flagyl or Metronidazole is that it has an anti-abuse effect. Now, what is that? An anti-abuse effect is if you drink alcohol with Flagyl or Metronidazole, Flagyl, it's all the same. It can make you so you get violently nauseous and vomit. Okay, it's not going to kill you or anything, but at times you may wish you were dead. But it will make you nauseous and vomiting. So sometimes, they'll say no medication, no alcohol, I'm on medications, and it may or may not be true. But with Flagyl, it's true. Do not drink any alcohol for days after you've taken it. If you take the big dose, you want to make 2-3 days after you take the big dose, and then certainly any time you're on those smaller doses, the 3-time-a-day doses, stay away from alcohol. If you don't, you will live to regret it. That anti-abuse effect is no joke. Okay, so that's our short little thing on Flagyl. Take it straight. It should clear up anything. It's a medication that's been around a very long time, very well tolerated. You'll do fine. For now, I'm Dr. Greg Hall.
Conclusion. During the course of hospitalization, this patient died from complications due to central catheter-related bacteremia. Thank you for your attention.